Let's move on though and turn now to the latest COVID outbreak in Melbourne. As we've been reporting today, new restrictions kick in this evening at 6 p.m. They include indoor mask wearing and limited numbers for private gatherings. Joining us live now is Bennett, the Chair of Epidemiology at Deakin University. Appreciate your time. So just to remind our viewers, we saw case 5 announced today linked to this cluster. And it's actually believed that he could be the source for the other infections in the cluster. He's been symptomatic for the longest period of time out of those 5 cases. So now, Catherine, for tracers, it's all about trying to connect that new case to the wallet man who had COVID that we learned about a couple of weeks ago. That's the holy grail now, isn't it?
Absolutely, Ash. It is helpful that they've identified the first in this cluster. It looks like this older gentleman in his 60s infected the first case we heard about yesterday back on the 18th, and that fits perfectly with him developing symptoms on the 20th and so on. So we're starting to move backwards, but it's probably still not enough. They haven't found any common sites, potential exposure sites between this older gentleman, this case 5, and the wallet man, his own, movements. So the timing still suggests there could be at least, one person in between, and that's where they'll be focused. But now they're focused on the person that's that next step back, the next chain back. Looking at his exposure sites, they might yet identify some areas where, at least if other people come forward for testing from those areas, we might identify what that missing link is back to the original South Australian infection.
And what do you make of the new restrictions announced today? Limits on private gatherings, indoor mask wearing. We've heard it all before. Is what was announced today sufficient, do you think? I mean, what level of outbreak do you think our leaders are now looking at to go to that level of a lockdown? When does that start to be seriously considered?
Well, hopefully they've done work after our previous lockdowns to figure out, if those safety nets or those insurance policies weren't required then, what does it need to look like in order to bring those in? They're very costly, very impactful interventions. So it's good to see they've put some measures in place. We have exposure sites across Melbourne, probably relatively low risk to most people at those sites, but you can't be sure that everyone who was at those sites will get tested or everyone will recognise symptoms. So while we're in this period where we're still assessing if there are other cases also from further back up the chain, it's important that we do what we can that helps contain that spread. So home or informal gatherings indoors, keeping those numbers down, I think, is wise. That's where we see the greatest amount of spread. That reduces your number of close contacts, as well as those informal, larger outdoor gatherings as well. But the mask wearing indoors, again, I think that's a safe thing to do, just as we sort out where we're at and whether there is further risk of undetected cases in the community.
Catherine, I wanted to ask you about wastewater testing. We know that authorities there in Victoria did reveal last week that testing indicated that there was COVID in some of those suburbs. How accurate is that testing, and how much can it actually tell us about how big or small a cluster could be? Is it actually clear from the wastewater, for example, if we're looking at 1 case or 100 cases in a certain catchment area?
Yeah, they haven't refined it to that degree. They can't say the volume of virus, tells them there's X number of people. They did have quite a strong signal, and that's consistent with, an active infection. Sometimes they get very weak signals that disappear again. That might be some latent shedding of the virus in someone who's no longer infectious. The wastewater's a part of the kind of signal system they use. We've seen cases where we had a positive turn up, they never found a case. It could have been someone who was still shedding the virus, who'd gone to a place just for a weekend to visit. So you can't always tell whether someone's just moved who you know about and you see them in Melbourne and something's going on. They go somewhere else for a visit. They might impact on the testing there. So it can be quite complicated to sort out. Also, if we do have a case in the area, and now at least we've explained the signal that they had coming from that northern Melbourne area, but it doesn't tell them whether that's still all the cases. They know someone's there, but if that person stays in the area, it could be covering up the fact that there is one other or more people there. So no, they can't quantify it to know exactly how many people, but it shows, as it's done before in New South Wales, that wastewater is useful just to step up our search for possible cases in an area, or in this case, a review of exposure sites to make sure nothing was missed.
It's sort of renewed people's passion, I think, for the vaccine after so much hesitancy lately. There's been a lot of discussion about what incentives might be needed to get people to have the jab. There's discussion about a vaccine passport as well. Some leaders, though, not so keen on that idea because there are still some unknowns, aren't there, about the ability of vaccinated people to transmit the virus. And some leaders are saying, well, yeah, hold your horses on that front.
Yeah, although the information that we're getting is getting better almost by the day. We've had 3 significant bits of information coming out of the analysis of UK real-world data over this last fortnight, and that includes very high effectiveness, not just against symptomatic disease and particularly serious disease, which we know about, but seeing incredibly high rates of protection against any symptomatic infection, even mild cases. And even where they do see some cases appear in people who were vaccinated, some of them were only vaccinated basically around the time they were exposed, that it's already they're seeing good signs that vaccination status of a case really does reduce their risk of passing the virus on by as much as 40 to 50%. And that's only after 1 dose. In the UK, most people still only have the 1 dose. So that's really encouraging, that if we are looking at people with 2 doses, you might not be able to guarantee that they aren't, an asymptomatic case, though that will be rare. But you will also know that even if they are, their chances of passing the virus on are not great. And equally, the variants of concern, people talk about that, but the ones we have to worry about, the ones that have really taken off around the world, are the strains associated with the UK and the Indian variants. And what we've seen is that both AstraZeneca and Pfizer are almost the same effectiveness against both those strains as they are against the wild type. There's only a mild reduction in effectiveness of 5% or so. So that, again, is really encouraging, that we have very effective vaccines. They're covering very well the variants of concern that are spreading and the ones we're likely to see here. And we know that, it's reducing transmission even in those few people who might still get an infection. Put all those things together, vaccines make a lot of sense. And they do suggest that people could be at sufficiently enough reduced risk of either having the virus or passing it on, that there could be some leniency around, whether it's quarantine if people are travelling or how we manage individual risk across the borders. State borders, I don't think we should close. I do think the system we have in a number of states now for permits, so they know who has moved into the state and where they've come from, allows them to work individually with people to assess risk. That's really important. And if vaccination comes into that conversation, it might make a difference between needing to quarantine for 14 days regardless of your test result, or just getting a couple of tests and reassuring the health authorities that you're not carrying the virus.
Catherine Bennett, these are all questions our leaders are grappling with at the moment. Appreciate you sharing your expertise with us.
Thanks. See ya.